Dr. Andrew Roop here at ThriveChiropractic, and I want to have a conversation about POTS, or Postural, Orthostatic, Tachycardia syndrome. I know that's a mouthful, but listen, even if you've never heard that word, you don't really even know what POTS stands for, if you've been given that label, what I want you to think about is this isn't really just a POTS-specific diagnosis. If you've been told you have panic disorders, different anxiety attacks, panic attacks, we're gonna lump those all together and talk about what is going on neurologically and how it's different than what those typical recommendations and typical, I guess, answers are. And really, answers isn't the right word there because there's not a lot of answers given if you struggle with POTS or any of those similar labels. Let's define it a little bit. What's usually going on when that's taking place is some sort of dizziness, lightheadedness, instability that takes place in general, but specifically when you're going from like seated to standing or lying down to standing. That's what that orthostatic part of it means. It means you are not well regulating blood pressure and you're not able to change those environments quickly, right? Because when you go from laying down to seated to standing, your body is instantaneously changing the vasodilation or vasoconstriction of different blood vessels so that your brain gets enough blood. Our bodies are so smart, they're really well designed, and they're making sure that the most important organ, your brain, is always well supplied with oxygen. And so we can, on a dime, transition and change that blood pressure. Just like you can go upside down and all of a sudden your head doesn't explode from too much blood, your body's able to reverse and flip some of those pathways. So what's happening in something like POTS, or like I said, similar panic disorders, anxiety attacks, when we're having this hyperventilating kind of loss of control sensation, is our nervous system, for some reason, is not doing that well, right? Our neurology isn't able to have that feedback loop. Maybe the external expression of that isn't working, right? We're not able to constrict or open those blood vessels properly, or maybe it's the feedback. Maybe it's that sensory input of our body's awareness of itself in space isn't properly sending messages to then have the correct response. But in some sort of simplified way, we can boil it down to that, right? Improper brain and body communication. That is why looking at the nervous system really is the solution to a lot of these things. Is because what's typically said is that this is a genetic issue, or honestly, there's not really a known cause. I just recently had a patients and family that were told, when their child was dealing with these panic attacks, these anxiety disorders, they were told that go see a counselor and maybe that is going to help them. Not the whole story. Love counseling, huge fan of taking that approach. Not what's going on when we're having those sort of cycles. Look at it from that perspective. Absolutely address the mental, spiritual, emotional health. We need to be taking care of that aspect of our wellness. But if we don't look at the nervous system, you're going to be stuck and not really getting the changes you need. So what's going on neurologically? Well, there could be a lot of different things. That's why we have scans and neurological tests to actually track objectively how is our body functioning. But I can guess that one primary spot that's going to be involved in something like POTS or those anxiety and panic attacks is that top of your neck. And looking at it from this fuse box perspective, if you haven't seen this before, what this is our framework of thinking about and looking at how is our nervous system operating. The right-hand column of this chart would be different symptoms or struggles. Lightheaded or dizziness would be up here. And what we can see is what are the different symptoms, what are the struggles somebody might be dealing with, and then why is it taking place, right? What do we see neurologically with scans, and how does that connect to the different symptoms that they're either currently experiencing or maybe are around or just about to experience around the corner when they have other challenges show up. So what we see with POTS is that usually that upper neck, that very top of the brainstem, is what's at the root of it. There's a nerve at the base of your skull, the top of your neck, called the vagus nerve. And that vagus nerve runs almost all of the calming wellness side of your nervous system functions. It's the parasympathetic function, and it runs our immune system, our digestion, blood pressure regulation, heart rate. And so that is what's often responsible for those quick adaptations and those quick changes in our blood pressure or our heart rate that take place when we're naturally going through different positions. So that is our first place to look. If we have some sort of upper neck brainstem, upper neck injury or damage, we are going to have compromised ability to regulate blood pressure, and therefore we're going to have a way harder time not getting dizzy, not feeling lightheaded, and struggling with all those issues. That nervous system stress can show up other places too, right? Maybe it's some of the different sensory processes in your mid-thoracic spine or the other end of your nervous system. Specifically, some of that thoracic tension can be involved too, because if we're not respiring and breathing properly, right? If we're not taking in oxygen into our lungs, one, that probably means that those pathways and centers are challenged neurologically, but it also means we're not going to have that full oxygenation to then fill our brain and our blood with the oxygen it needs to balance out everything else. So that can come back to that fight or flight posture and tone. If your body is in this sympathetic, rounded, forward, flexed state, you're gonna have a hard time opening up and expanding your lungs, and then it's gonna be even harder to then change positions and adapt to it too. So if you feel like you have been more or less given no answers, told this is just genetic, told this is something you just gotta deal with, I don't think that's the whole story, right? I can think of several females specifically, right? Because this way disproportionately affects females over males. I can think of several our moms at Thrive who had this either POTS label or very similar diagnoses and symptoms, and then either don't have it anymore or are dealing with way, way less symptoms and are doing so much better now. So please let us help. If you're looking for actual answers, let's do those scans. Let's do those objective tests and measurements and see, is that what's going on with your system, or is there something else too that we need to address? We're here to help. Reach out if you got any questions, comment on this video, contact our team. And if you know someone who's dealing with this, if you feel like this might be helpful, please share it. I've seen so many people from all over get help from just somebody that passed on a video or sent them a message. So if that's you, pass this on because it could help a friend a ton. Thank you guys so much. Look forward to meeting you soon.